Good morning and welcome to MS There is Hope. That's going to be the name of our program. I'm with Dr. Tressa Pinkleton this morning from Seattle, Washington. Good morning, Dr. Pinkleton. We are going to be discussing today vitamin D, high vitamin D numbers, which is typical, and the absorption of vitamin D via the supplements, why we take the supplements to allow our bodies to absorb the vitamin D. Me and Dr. Pinkleton hopefully are going to interview every 2 weeks on Thursday mornings. So if you mark that on your calendars, we will try to answer a few questions and it'll be very brief. Today's going to be very brief. I'm going to read a short disclaimer and we're going to jump right into the interview. This interview is from our own personal experiences, and we are not talking in specifics, but in general terms about our experiences while doing the Coimbra protocol. We are not giving medical advice or addressing anyone's individual cases. Cases and results can vary using one method or another. Medical protocols and methods of treating MS should be done with a licensed medical professional. Thank you for being with us this morning, Dr. Pinkleton. If you could address vitamin D.
Where do you want me to start off? Which one?
That's probably a huge. So how about vitamin D? And people are always freaking out because typically they get a urine calcium, and the amount will be 400, 500, 600. But they're not dividing it by 1,000 milliliters. And usually they fall well within the range.
So the urinary calcium is a thing that does come up often in my office. I was trained that we want ideally less than 250 milligrams for the full 24 hours. However, less than 2 or up to 250 per liter voided is also acceptable, is how I was trained. And so the way that one can figure that out is you take a look at how much was voided, and you take a look at how much urine was voided total, and then how much of the calcium in milligrams was voided, and you can do the math through division to figure out how many milligrams per liter of calcium one is putting out. Now, one thing that I have found through the years is that when we see the urinary calcium increasing, sometimes that can actually be because we are consuming too little calcium in our diet. One of the main things I've been really coming to.
I'm sorry, interrupted you. I didn't mean to. I'm laughing because I was drinking green smoothies with citrus, and which I found out later it broke down the greens, and I was getting calcium, and my calcium numbers went up, and I was like, I'm only drinking a green smoothie every once in a while. We're allowed to have those. Well, we're allowed to have greens.
You're allowed to have greens. Yes, you're allowed to have greens, but when you mix them, I tell people you can have your dark leafy greens, just don't turn them into a beverage, But also, so urinary calcium being elevated, it can be a reflection of too much dietary calcium for the protocol. It can also be a reflection of too little dietary calcium. And so that's why it's important to work with a protocol doctor, because we can help figure that out for you. There's a kind of this feedback system of calcium regulation in our body that also involves PTH that will become activated if dietary calcium drops too low. And one thing that I've seen on this protocol is some people, they hear low calcium diet and they translate that to no calcium diet. And that's not what we're aiming for here. But the calcium being high in the urine is a thing that we need to track and we need to keep aware of. You will often find numbers higher than what the typical normal is, but just knowing that for most people, so long as they're below that 250 milligrams per liter, they should be fine. Now, if I have somebody that's like a 600 or 700, my red flag kind of starts to wave and I want to take a look deeper into that. But most of my patients in office run anywhere from 150 to maybe 400, and I'm perfectly fine with that so long as their output of urine is at least above 2 liters or 2,000 milliliters. Yeah.
So can you address, and now this is something that I never really understood, and there's why. I know people personally that don't take all the supplements, and they take the vitamin D and they're able to absorb it evidently. And then I know people that take more supplements than what I personally take, because their body is not absorbing the vitamin D evidently. Can you address that?
Yeah, absolutely. One of the main things that we need to help our bodies absorb vitamin D is magnesium. And even before I became a protocol doctor, in my office, if people were having issues getting their vitamin D levels up, I would say, hey, let's add some magnesium into the mix. And then I'd see that finally kind of shifting in their blood work. We are, as a society, I would probably even wager as a global population, horribly deficient in minerals, mostly because of the way our modern agricultural system monocrops and just depletes the soil. We don't, big farms don't tend to rest their fields ever. And that's causing problems these days. And I see a lot of mineral deficiency in my office, both on and off the protocol. Also, we get our minerals from vegetables. Most people don't eat enough vegetables. So we add magnesium into the cofactors, or what I call the multivitamin component of the protocol, to help with the absorption and also help with the activation of vitamin D. Magnesium is needed for that. Zinc is another mineral needed to help absorb vitamin D, which is one of the reasons why it's included in the multivitamin component. And then we also need vitamin K to help with vitamin D absorption. Now, there's a lot of talk about vitamin K in reference to the protocol, and you and I should have a podcast about that maybe next time. But one of the best ways to get vitamin K into your body is through dark leafy greens. So again, eat your leafy greens. Just don't turn them into a beverage, and you will have enough vitamin K. You should have enough vitamin K to be able to absorb that vitamin D. Now, sometimes people have other issues which impede absorption, like a gastrointestinal disease, things like Crohn's. You can have IBS, so that can cause a lot of malabsorption issues. People that have gone through various abdominal surgeries, whether that be gastric bypass or resections. I've even seen people that have had appendectomies, had their appendix removed, have that cause some issues with nutrition, which we can easily correct. So if one is on the protocol and they're finding that I'm taking all of these things, I don't seem to be absorbing it, talk with their doctor about it. Maybe they need to shift their diet, bring down GI inflammation to help get better nutrient absorption, so that you don't have to take handfuls and handfuls of supplements all the time, which in my practice I see kind of cause their own issues. Sometimes my favorite things to do in practice is when someone's on like 30 supplements, just knocking 2/3 of them down and then finally seeing some of their function improve, because I don't believe the body likes taking loads and loads and loads of pills, which is one of the reasons I developed that CP multi, because it takes a lot of the fillers out when people were before kind of piecemealing that multivitamin component together. Anyway, hope that answers your question.
I think it does. Is that all the time you have today?
I got time for one more.
All right. How about, why don't we just talk about heat intolerance and sunlight a little bit? Touching on that, I told you, I think that I recently just had it go away. And that's something that I haven't read personally in the last 4 years. I haven't read of anybody else having that. Some have since then came out of the woodwork and told me, yeah, my heat intolerance went away. That was wonderful. But why do we have a heat intolerance?
Well, there are a couple of reasons that people think patients with MS have heat intolerance. One is sometimes patients can just have difficulty regulating their body temperature. It takes the nervous system to do that. And so if there's some lesion around or in the part of the brain that helps to do that, that can impede the body's ability to really, work on its vasodilation and response to heat in general. But another thing that, when people talk about heat intolerance, some people say, I hate the heat. It just makes me feel really awful. And that's what I'm talking about in terms of heat, body temp regulation. But some people, when they reference heat intolerance, they're talking about when they get heated, their MS symptoms increase. And so the way that I explain this is, if you think about the nervous system as an electrical system, because that's what it is, it's our electrical system. And many electrical wires are insulated because that helps conduct the electricity from, the one end to the other, right? And that's the myelin sheath of our nerves. It's our insulation of our electrical system. Now, in physics, we learn that when the insulation is compromised, the electrical impulse has difficulty getting from point A to point B. So when we compromise our myelin sheath, or when our myelin sheath becomes compromised, the electrical impulses can have difficulty, right? Okay, this is MS. Heat increases the rate of the impulses from point A to point B. So if you're having an increase in the rate of the impulses and having the myelin sheath or the insulation compromised, you're going to have some symptoms or extra symptoms, which is why I'll see that a lot when people are exercising, and I'll say, try to keep your body cool, have a fan on you, get a cold towel wrapped around your neck, because if you can just keep your brain or your brainstem a little cooler, you'll have less symptoms when your body gets moving. Does that make sense? It's a little more complicated than that, but that's the easiest way that I can explain it to people. It has to do with what happens with electrical impulses when temperatures rise, and the fact that the myelin sheath isn't completely patent from point A to point B. And so when people are on the protocol, one of the things we have seen is lesions start to shrink. I've seen MRIs where lesions are completely gone. And so that myelin sheath is healing, and that insulation is rebuilding itself, so the impulses can go more smoothly from point A to point B, thereby having less symptoms. And the heat intolerance can start to resolve itself. Does that make sense?
Yes, it does. Personally,
Okay.
for myself,
Yeah.
I didn't have a heat intolerance. I got MS. I started the protocol, didn't have a heat intolerance, and then I got it. And I live in the Midwest, and my wife said it was like watching a flower fade.
Yeah.
When it would get hot, I literally would get so weak that I couldn't lift my head off my chest.
Yeah.
I mean, my energy totally depleted. And now I go out in the sun all the time. I love it. One thing you touched on there that we're going to touch on in an upcoming interview. The next interview will probably be about vitamin K and the body absorption. The other is neuroplasticity, and can we rebuild the myelin sheath? There's been some debate about that. I'd love to hear your opinion on that. So we'll try to get that in one of our future interviews.
Yep, absolutely.
Thank you, Dr. Pinkleton, for your time. And we look forward to seeing you here in a week or two.
Yeah, thank you for having me.
All right. I'm going to get off here. Take care.